I just would like to just highlight a few things with our pancreas program and then talk a little bit about the technology that we have here. You've already heard from Dr. Luthenhausen about the robot, and we do use the robot for pancreatic surgery as well. We've launched that program earlier this year. But I want to talk about a different technology called NanoKnife. First of all, before we talk about that, the pancreas program now, for about the 5th year in a row, is going to hit this year, probably hitting 75% of all the pancreas surgery done in the state of Illinois, done here at Northwest Community Hospital. That means a lot. If you think about it, that means taking every other hospital in the state of Illinois, whatever they do in pancreas surgery, adding it together and doubling it, and it still doesn't reach what we have here. And that's 5 years in a row. So that volume allows us, first of all, that volume doesn't occur by accident. That volume occurs based on the blood, sweat, and tears of a lot of people. We have our fearless leaders here who are instrumental in giving me or the program the tools we need to do the kind of surgery and the volumes that we need. It's blood, sweat, and tears of nurses and physician's assistants. We have some of the best I have ever seen, and I'm talking about a career that spans over 30 years in many different hospitals. Really just some excellent, committed healthcare providers. And what it does is, with that kind of backing, we're able to invest in technologies that just other hospitals just don't have. We were one of the first in this area to have a NanoKnife technology, and really, quite simply, what a NanoKnife is, it's a tool used in the operating room where normally for a pancreas tumor, if it's close to a vessel or wrapped around a vessel, a lot of surgeons don't want any part of that. They will say, boy, that's unresectable, also called locally advanced. They'll tell the patient to go to chemotherapy or radiation, and the life will be measured in months. And of course, that was also the way we were working up until the time when we got our NanoKnife about now 2.5 years ago. The NanoKnife allows those patients who are locally advanced to see the inside of an operating room. And what I can do during the surgery is use this tool to clear tumor that might be wrapped around vital vessels. And what it allows these patients, these select patients, to get the chance for a margin negative or a margin clear resection. And so now we have patients hitting almost 2.5 years with the NanoKnife. Everyone doesn't get a home run, but we have many patients who are now going on 2.5 years alive, doing well, no evidence of disease. And these are patients who were told at other places, get your affairs in order. They were told this 2.5 years ago. And so it does hit home runs for a certain select group of patients, not for everyone, but for me in my practice, it's really done a tremendous benefit for those select patients. And we'll have kind of a demonstration of the NanoKnife in a little bit more detail for those people who are a little more techie and want to know how does it work and how does it preserve the vessels. We can talk to you about that up there. But thank you for coming. We really appreciate it. It's a great opportunity for us to highlight some of our technology. Hopefully you guys can get in there and kind of use some of it, see what it's all about. That's what you're all here for. So thank you very much for coming.